we're a country that even in this economic recession, we can, if we wanted to, provide basic healthcare services and access to healthcare to everybody, and we choose not to. And part of it's because it seems that we're choosing to view healthcare as a privilege. That's essentially what we're saying to people. And that part doesn't honestly make sense to me, because if there's one thing that I've learned studying medicine, studying the body, studying epidemiology, is that although there are some aspects of health and disease that are affected by the choices that people make, a lot of it's not. A lot of it's not people's quote-unquote faults, and a lot of it's determined by things that are going on in your body that you have no control over, where you live, how you grow up, and we're punishing people for all of those things by not ensuring that they have access to health care to be healthy people, which really forms the basis of life. It's really difficult to raise a family, it's really difficult to have a job, it's really difficult to do all those basic things, to live life, if you don't have your health in place. And we should be striving for that as a society, I think. And that's my personal opinion. It should be people's right to be able to have access to something that's so fundamental to them as a person, as a human being. And I see that every day. So there's too many people who walk through my door, too many patients who walk through my door who have stories, and those stories make sense to me in terms of, like, I'm trying to do right by life. I'm really, really trying to do right by life, Dr. Silva, and I'm having a hard time doing it. And I can do some things, but I can't do everything. And it would be a lot easier and a lot more appropriate if I could ensure that they had health care coverage. So if things happen, or if they need more than what I can provide for them, I can give it to them, and I should be able to give it to them. And sometimes I can't, and that's really frustrating.